Hello, and welcome to the Clinical Care Options Medical Specialties Podcast. I'm your host, Joshua Schechtel. Today's episode features a conversation between Evette Whaley, who is a parent of children with atopic dermatitis, and Katie Smiley, a physician associate at Rady Children's Hospital in San Diego, California. They're talking about how we can better address the care of children with atopic dermatitis. For more information on Katie Smiley and Evette Whaley, along with a link to more resources, please visit the show notes for this episode. Now let's get started and hear what the experts have to say about this important topic.
Before my son received his diagnosis for atopic dermatitis, we noticed a change in his skin. Just so you know, his diagnosis was received around 6 months. We noticed his skin, as much as we moisturized it, he was still visibly irritated. He would sit in his infant seat, I remember, and he would just move his back from left to right, just swaying as if he was trying to scratch his back. But at the time, we didn't know it. He also was very, very, very irritable. He cried a lot. We would take him to the doctor to see if he had some form of acid reflux or if there was something we were missing. The pediatrician said, everything checked out. All of his functions at 6 months seemed to be where they needed to be. And he was an exclusively breastfed child. In that time, the doctor noticed that there was definitely something going on with him because he had like this red hue under his skin. We're in an African-American family, but his skin was very, very brightly irritated. The best way for me to describe is almost like somebody would took a red lamp and placed it under his skin. But you could tell something was very irritable to him. Typically, the doctor said she would not run allergy tests at that age, but she did. And she also said, he had some irritants from foods in addition to the eczema. We could tell he was highly irritated by the eczema.
When I'm speaking to patients, how I explain the diagnosis of atopic dermatitis, I often will use eczema just because that's typically a more common phrase that people know. But I explain it as it's a chronic inflammatory skin condition that causes red, itchy patches on the skin, typically in some characteristic areas. It's a result of two main processes. One is a skin barrier dysfunction, and two, there's some immune dysregulation. The reason that we have eczema, the cause of eczema, is a little confusing to even providers, but it's a combination of both genetic and environmental factors. Genetically, we see eczema oftentimes in families that have other similar allergic conditions. So eczema typically exists in patients and in families with food allergy, allergic rhinitis, and asthma. We call that the atopic triad or atopic march. Not every patient reads a textbook, so it's not like a life sentence that if your child has eczema that they're absolutely going to develop food allergy, allergic rhinitis, or seasonal allergies or asthma. But we just tend to see eczema develop in patients that also have those conditions, and they might potentially go on to develop those too. Or if mom, dad, siblings also have that. Genetically, it's actually pretty funny why we have eczema. So eczema is an immune dysregulation in part of our immune system that we call a type 2 immune system. Ancestrally, like in the caveman days, it was our type 2 immune system was important for parasites. We in America live in a first world country, so we really don't encounter parasites very often, but some patients have this really highly functional type 2 immune system. So if we were in a third world country and there was lots of parasites around and dirty drinking water, things like that, that immune system would be very, very active. Except we live in America where we don't really encounter those parasites. And so these patients have a really highly effective type 2 immune system that just sits there and says, okay, well, I don't see parasites, but what else can I do? And then we'd go on to develop allergies, eczema, food allergy, and so on and so forth. Eczema is a chronic condition, as I mentioned, and we don't have a cure, but we do have lots of treatment. We are becoming and developing more and more treatments as the years progress, which is exciting, but there is no cure. So it's important to be able to recognize what flares, what things that trigger our eczema. Sometimes we can't necessarily pinpoint it, but eczema can flare. And then we also have medications and treatments that we manage when eczema is good, or how we maintain clear skin. So when I'm evaluating patients, especially the first visit, when they come and see me, how do I evaluate their impact of the disease on both the patient and the caregiver? Is kind of a twofold approach. One, obviously, you need to kind of get the objective assessment. So kind of entirely looking at all of the skin, evaluating that. In our clinics, we will oftentimes do EASY score, the Eczema Area and Severity Index. It takes a little bit of time, like 5 to 10 minutes, but it's a really, really good comprehensive score that tells us kind of how bad and how diffuse their eczema is. But in every single eczema patient, if I have a little bit less time, I'll always do a body surface area evaluation, or a BSA. And I always do Investigator Global Assessment, or IGA score. Those are both very quickly done. You can do it in a couple minutes. And it's really important that you can track as you see them at follow-up visits, you can really track how well they're doing with treatment success and treatment failure and things like that. And then honestly, the more important part of eczema is assessing how it affects the patient subjectively. So most of these patients are kids. We ask the patient as well as the caregiver questions, because as we know, eczema has an impressive impact on their quality of life. So I always ask about how is their sleep? How are they doing emotionally? Oftentimes I ask them how they feel about their skin, because depending on how the patients age, a lot of times they spend an enormous amount of time thinking about their skin. So kind of asking those like open-ended questions really kind of invites them in and to kind of get a sense of how much this actually does affect them. And then lastly, I always ask them how their eczema impacts their activities they love to do. For instance, like, are they not able to play the sport that they really want to play because they know if they jump in the pool that their eczema is going to get worse? It's a nice question to ask at the very beginning when you first meet them, and use that as kind of a goal for treatment success. Is okay, if we can get your eczema so well controlled that you can get back in the pool and swim or play the sport you want to play or join the debate team because you're no longer self-conscious of your skin, that's, I think, really true success.
This is going to sound strange, but I felt relief because it had a name. Going those number of weeks, knowing that my child, something was irritating him and not knowing what it was. But once me and my husband, once we found out that it had a name, we figured that was a way to care for it and a way to help him. Knowing that, there are things that we could do to help him was a relief to me as a parent. And from that point, we were able to, start applying the methods and the techniques and the medications that the healthcare team was giving us to provide him some relief. So I was relieved to find out that it had a name and that it was treatable. It wasn't something that was incurable or something that couldn't be treated at all. So the best way for me to communicate with my healthcare team to let them know how bad my child's symptoms are is I like to take pictures and videos. They say pictures are worth 1,000 words, and I think they are. And I feel like videos are worth even more. I like to show them, this was on Monday and this is the following Monday, or this is the following Monday, to show them the timeline of how, that area may be progressing or not progressing. And also, I think the videos are powerful because it helps show the healthcare team, they can see the problem as well as how it's impacting my child. They can see how the child is responding, how the child, emotionally, how they feel, is how bad are they irritated by it. And, sometimes I would, just video my child sitting there for 2 or 3 minutes doing their regular kid thing, and just to see how many times they may attack that particular area, that itchy spot or that skin area that's very dry. But I feel like, pictures and videos are the most effective way for me to communicate with my healthcare provider, and also using the portal that's provided by the healthcare team.
So when speaking to patients and caregivers about eczema treatments and kind of the path forward, it's really important to focus on informed shared decision-making. Shared decision-making is obviously a very popular keyword, but I really emphasize the informed aspect of it. So knowing and educating patients about what causes their eczema, what we know that causes their eczema, and also things that we don't know that doesn't necessarily cause their eczema, as well as treatment options that we have available to us, both topical and systemic options. We spend a lot of time in our clinics just educating. Oftentimes the first visit, I spend 20, 30 minutes, as long as I have time, really just educating the patients about what eczema is, what treatment's available, even if it's not necessarily treatments that I'm going to be choosing or recommending to them just yet. But it's always, I think, important for them to know kind of the landscape of the options that we do have. So I talk a lot about toolkits, having medications that we can use for when things are flaring and when things are in maintenance. And I think letting the patients have that kind of education behind why we choose and recommend medications and why we choose and recommend non-therapeutic options as well really helps kind of have the ability to choose what's best for their lifestyle. I oftentimes will emphasize that it is a chronic disease. A lot of times patients will get very, basically they'll settle for oh, I'm a little bit better. So I think setting realistic expectations, but also kind of pushing them as well as pushing us as providers to be better and have a clearer skin. And then you always like with asking open-ended questions and kind of discussing all the treatment options, just leaving that eventual final decision to the patient and caregiver really puts them in the driver's seat. I always say, like, I'm here to recommend treatments and eventually prescribe, of course. But at the end of the day, we want to pick treatments that is going to work best for that patient and that family.
I like the fact that some of the treatments provided relief for my child. I love it, when things work as planned based on the research or what, the doctor has been told about this particular medication. What I do not like is when the medications do not work, or if the medication I feel is being overprescribed. I've had times where my son's skin, I say it melted away. The whole topical layer of the skin just pretty much disappeared, and you could just tell it was just irritated. Whatever the layer is below the dermatitis, the layer of the skin, it was just very sensitive. It was sensitive to even just cool water touching it. So I don't like it when feel like they were overprescribed. And about the treatments, what I do like about the treatments for my child's eczema is when they provide relief. When my child looks forward to it, my oldest is 10. He knows what to expect, the long bath, getting out immediately, being moisturized. And, he wants to be part of the process. So, the areas that are not affected at that time by the eczema, he enjoys putting the emollient on his skin to help lock in that moisture. We talk through it. He loves science. He loves math. So we can go to a more scientific level of why your skin needs X, Y, and Z.
So oftentimes I see patients who come into my office and they'll be on a fairly complicated regimen. And I appreciate how much time it does take to take care of kids with eczema. And so my job is just hopefully trying to make it as simple as it can be. So I will use, like in my instructions when they go home, I'll try to simplify the routine. So I'll kind of designate, okay, these medications are topical steroids. These are what we're going to use for our acute flares. And then we have these medications that I'm going to recommend that are non-steroidal options. And this is what we use for maintenance. So I kind of lay out what medications are, why we use medications for what reason. And then I try to keep it to I always say, like, hopefully a max of 3 topical medications, because I think anything past that is way too difficult. So it's something for the face, something for the body, and ideally something that we're using as maintenance that we can use on both areas. Trying to be as clear. I will bold medications, bold how frequent I can use it, things like that, just to make it as clear and legible as I can. And also I think there's a really important use of just like frequent check-ins. We have access with patient messages with our electronic medical record. I always encourage patients to send me pictures, send me messages if things aren't going well. I also always ask if they really are going well. I love to see those photos too. But I oftentimes will get oh my gosh, we're flaring, what do I do? Because I'll tell patients that eczema is a journey. Like I mentioned, it's a chronic disease. There's no cure. But I am on this journey with the patient and with the caregiver. And so if they ever need assistance or help, they don't necessarily need to make an appointment to ask me, okay, do I put on this medication or that medication for this flare for this area of the skin? I always just encourage them to reach out, because I just want to have an open communication with them. And then we will do frequent actual visits to see how things are going. Typically I see the first time I see a patient, I'll typically see them like in a month. To see how things are going. And hopefully as things get better and improve, we kind of spread that out. And then, of course, if there's situations where these patients need referrals, I work in allergy, so I do see eczema kids and we'll do food allergy testing and seasonal allergy testing and things like that. But I previously worked in dermatology, and so I always would have a very low threshold to refer to my allergy colleagues when I was in dermatology, just so we can kind of get that more comprehensive evaluation. And I'll follow that up when you do refer. Trying to simplify the routine and have a cohesive routine between 2 specialties is also very important as well.
We stopped using the injectable medication due to the amount of trauma it was causing my child. He is 10 now. He started the injectable when he was around 6. He would receive the injectable every 28 days. That was after the first dose, which was 2 doses. And we did that consistently for at least 3 years. As we enter the third year, our 28 days, to be honest, they start stretching out further and further. Each time we gave my son the injectable, it was a household event. He knew that the day was coming because he knew 28 days, that was exactly 4 weeks. So if Wednesday was the day, he knew in 4 more Wednesdays he would have to go through this again. So he'd be like, okay, it's not this week, it's next week. And he would cry and cry and cry. We tried other techniques such as the topical, I think it was lidocaine, we would put on the area and hopefully that it would numb him following the instructions that we were given. And he would still have, the same trauma. We started out with the pen. Then after the pen, we moved to the syringe. Both were very painful for him. The idea of moving from the pen, when you do the injectable of the pen, it's that waiting period. He would watch that little yellow window expire, and it was just painful for him. He would just scream and scream and scream. His older and his younger sibling both want to come running to the room and like, what's wrong, what's wrong, what's wrong? So it was a lot of emotions, and he would be traumatized. He would cry for at least 30 minutes after the injectable.
For patients and caregivers, the recommendations I have to address their atopic dermatitis is, one, I always say moisturizer is medicine. So regardless of what medications we are on or what like non-therapeutical medication treatments that we're on, moisturizer is medicine. All of the topical medications don't moisturize the skin. All of the biologic medications or systemic medications also don't moisturize the skin. So really, really, really paramount is moisturizing the skin with those thick moisturizing creams and emollients to help protect that skin barrier. I also recommend avoiding triggers if we know what triggers cause or tend to have flares. Obviously, sometimes we can pinpoint what caused that flare, and I would say most of the time, and I'll tell caregivers this, most of the time we have no idea what caused the flare. But if we do know if it's an allergen or if it's a detergent or a perfume or something like that, trying to avoid that as best as we can. We talk a lot about gentle skincare, of course, so no fragrances, fragrance-free things, often refer to the little lowercase e from the National Eczema Association that's printed on a lot of products, because a lot of times we'll get questions about, well, what do I use? I tend to not refer to specific brands, but I'll just say look for the little e, and that'll be safe. And then, as I mentioned, so eczema is a chronic disease, and so I think a lot of times caregivers get kind of disappointed, but just reminding them that this is kind of a long-term journey we're on. We have a lot of medications that we can use and also some non-therapeutic options as well, but we'll eventually get there. Sometimes it's a little bit of trial and error, but we'll get there. And like I mentioned earlier, we have a toolkit. We have medications that we use when things are flaring, and we have medications that you can use when things are in maintenance. And my goal is to hopefully help patients use more medications for maintenance, so when their skin is clear, and less medications because we're flaring less. But in that same hand, a lot of times with chronic diseases, people will settle and say, oh, I'm using this treatment and I'm better, but they're still having flares, they're still having sleep disturbances, they're still having an effect on their quality of life. So I also kind of take onus on myself as like the provider, but also kind of pushing it back to the patient, or I'm turning it back to the patient, and kind of together, I'm like, we can do better. My goal for you is to have clear skin and not have to think about your skin. There might be a few flares that come and go, but I don't want frequent flares. So if things aren't working well, even though they're better, that's not what I consider treatment success. Obviously, if a patient's like, no, I'm good, I'm happy, I'm not going to push it. But if there's still some room for improvement, I always say, let's talk about other options. We can try other things.
The advice I have for other people caring for children with eczema is talk to your child, see how they're feeling. I would definitely say, in my opinion, the emotional health of the child is just as important as their skin health. I talk to my children, even my youngest, who's 4, who also suffers from eczema. She'll say, Mommy, I'm itchy. And, I try to tell her, let's not scratch. Let's apply we do cool patches here, or frozen green beans, sweet peas. We place on the area to cool the skin down. She understands that cooling sensation does help stop the eczema from being so active. And she understands the bath. So I keep the constant communication based on their age, talking to the child. Also, I would say also have a good relationship with your care team. Make your doctor a part of your family. Make the doctor part of your friend. Don't make them an outsider. Embrace the situation with the doctor. The doctor has definitely, and the care provider has definitely seen other people with eczema. Explain your story to them. Yes, make the best of those, whatever 10 or 20 minutes you get with that care provider. And keep constant communication. Don't let it just be a once a year or once every 6 month check-in. Send them a message every other month, or send them pictures, or say, hey, I noticed this is working for my child. Can we note this in their file? I know as a parent, I keep medical notebooks for each one of my kids. And maybe by year or whatever they experienced that year, something that we could go back and reference. So in my case, it came in handy after I had, my two with the eczema are 6 years apart. And I said, okay, I remember when he was this age, this is what we did. And it's helped me with some of the processing with my youngest. So keeping that document will help you. It will also help when you're not around. You may have another care provider available who's caring for that child. That way, it's like an instruction book for that child. Also, find out other resources in your area with people who may have eczema. You may be able to be a support for them, or you could find more support for yourself. Maybe speak to your care team to see if there are any eczema studies or eczema research programs that if you're interested in, that you could be a part of to help, hopefully one day there will be a cure for all things eczema, and our children will not have to go through some of the things that they are going for. And one last piece of advice that I have for people caring for children with eczema is also make sure you take care of yourself. It can be very taxing, heavy burden to lift in taking care of your children and seeing the impacts of what eczema is doing to them, caring for them emotionally as well as physically.
Thank you, Katie and Evette, and many thanks to you, our listeners, for joining us. As a reminder, to view additional resources, please check the link in the show notes, and be sure to check back regularly for more episodes on important medical specialties topics.